Hey, everybody. This is lecture 2. It's about child abuse and neglect, and I promise it's not very long. Okay, I'm going to share. Okay, so objectives for today for this lecture is to identify the different types of child abuse, signs of that type of abuse, and actions that we should take as a physical therapist. There is a case study, Jerry, and there's also a discussion post. So, the Child Abuse Prevention and Treatment Act of 1974 stated that the physical or mental injury, sexual abuse, negligent treatment, or maltreatment of a child under the age of 18 by a person who is responsible for the child's welfare is considered child abuse and should be reported. The Federal Child Abuse and Prevention Treatment Act, or Public Law 93-247, requires that every state have a system for reporting suspected child abuse and neglect. Child abuse mandates a breach of confidentiality that is supported by federal law. Really critical that we know this. I can also tell you that the boards does like some of these like federal laws, and they're very important. So remember, you can breach confidentiality if you need to report child abuse. And every state has a different system for reporting child abuse. In 2000, it was estimated that 879,000 children were victims of abuse or neglect. It is the major cause of neurological trauma in children. Normal kids end up with kids with major neurological disturbances because of child abuse. Kids who have disabilities are at increased risk. And I want you to think a second for why. Why do you believe that is so? So some things that are related to it include the child's behavior, right? Some of our kids with disability have very challenging behaviors. They have very challenging medical needs and physical needs that can put a lot of stress on families, mental stress, economic stress, marital stress. A lot of our kids who have disabilities are born into families who don't have very many economic or social resources as it is. And rates related to child abuse and neglect have escalated since COVID. I'm not sure if they've come down yet or not, but COVID really increased the rates of abuse and neglect. Kids were home, parents were forced to have to teach them, very challenging times. So what are some of the signs of abuse? We may see a sudden change in the child's behavior or their school performance. If the child hasn't received medical attention or physical attention to problems that were brought forward to the parents. So maybe you mentioned to the parents, this child has a rotten tooth. You really need to go see the dentist. And no attempt at all is made to go see the dentist. That could be an example of medical neglect. If the child has learning problems or difficulty concentrating that cannot be attributed to specific physical or psychological causes. Child abuse is an adverse childhood experience. It can affect the neurobiology of the child, and it can result in learning problems and attention problems. Is the child always watchful, as though preparing for something bad to happen? Does the child lack adult supervision during the day? Is the child outside running around playing when there's a busy street right there or a pond nearby and nobody's watching them? Is the child overly compliant, passive, or withdrawn? Do they come to school or other activities early, stay late, and not want to go home? So those are characteristics that we may see in the child. In the parent, we may see a caregiver who shows little concern for the child. They may deny the existence of a problem or blame the child for the problem. They may ask teachers or caregivers to use harsh discipline if the child misbehaves. And they may see the child as entirely bad, worthless, or burdensome. So those are your red flags in caregiver behavior. A few more. The caregiver may demand a level of physical or academic performance that the child cannot achieve. And they may look primarily to the child for care, attention, and satisfaction of their emotional needs. And of course, that would be an example of emotional abuse. In terms of the parent-child dyad, we may see that they rarely look at each other or touch each other. They each may consider the relationship to be entirely negative, and they may state that they do not like each other. So what are the different types of abuse? There's physical, there's neglect, sexual, and emotional. And often they're found in combination with each other. So here are some signs of physical abuse. We may see unexplained burns, bites, bruises, broken bones, or black eyes. We may see fading bruises or other marks that are noticeable after an absence from school, right? The caregiver may keep the child home while the bruise is really fresh. The child may seem frightened of the parents, protest or cry when it's time to go home. They may shrink at the approach of adults. We may see head injuries, brain injuries, and internal injuries. What are the signs of neglect? Neglect occurs when the child's basic needs are not being met. We may see malnourishment, including reports of hunger, or eating a nutritionally inadequate diet. We may see medical neglect, where the parent refuses to seek or maintain necessary medical intervention, including dental care, or we may see excessive cancellations. We may see educational neglect, where the parent is indifferent to the child's school attendance or cognitive development. We may see emotional neglect, where the parent is indifferent to the child's need for physical contact and psychological nurturing. And another form of neglect can be in the form of poor hygiene, such as soiled clothing, soiled skin, skin breakdown, especially in the diaper area. Sexual abuse. I can tell you the few kids I've seen who did experience sexual abuse had the most bizarre behaviors I've ever seen in my life. Signs of sexual abuse are likely to be behavioral and can include anorexia, bulimia, enuresis, problems with peeing and pooping, abdominal pain without an organic cause, atypical shyness, being very extroverted or hostile, and of course, sexually acting out. They may have difficulty walking or sitting due to injuries in the genital area. They may suddenly refuse to change for gym class or participate in physical activities. The kids I'm thinking of, they actually were in foster care at the time, but they had a history of sexual abuse, and they would poop their pants and then smear their poop all over the place. And I mean, these were older kids. They weren't babies. Babies do that sometimes, and they play around with the poop. But these were kids who were like 3 and 4 years of age. In terms of sexual abuse, we also may see nightmares, bizarre or unusual sexual knowledge, becoming pregnant or getting venereal disease and running away. So signs of emotional maltreatment can be extremes in behavior, such as being overly compliant or overly demanding, extreme passivity or aggression, being inappropriately adult or inappropriately infantile, right? So these extremes of behavior. Having delayed physical or emotional development, attempted suicide, and a lack of attachment. A lot of our kiddos who come from countries in which there are orphanages, especially in orphanages where there's a very high ratio of children to adults, suffer from emotional maltreatment. And if these children are adopted at too old of an age, they can really have a problem developing any type of attachment to an adult and develop severe behaviors as a result of that. So Munchausen syndrome by proxy is a specialized form of child abuse. I strongly recommend you watch The Act if you haven't watched it already. And I believe the person that was based off of now has a reality TV show. Gypsy Rose, I think is her name. I haven't seen the reality TV show. I did watch The Act though, because I have seen several kids in my career who did have Munchausen syndrome by proxy. I can tell you I was fooled along with the doctors. So Munchausen by proxy is a specialized form of child abuse in which a physical or mental disorder of the child is either fabricated or induced by the parent or another adult caregiver. So the child essentially has nothing wrong with them, but the caregiver is maybe giving the child some kind of herbs or medications or doing something to the child that is inducing seizures, vomiting, whatever. Signs of this would be persistent or recurrent illnesses for which no cause can be found, discrepancies between what the history is and what the clinical findings are, symptoms and signs that do not occur when the child is away from the mother, unusual symptoms that don't make any clinical sense, persistent failure of a child to tolerate or respond to medical treatment without clear cause. Sometimes what we also will see in the caregiver is that they're less concerned than the physician about what's going on. The caregiver really gets into their child's illness, right? They kind of get fed off from the intention that the child is getting from the medical staff. If we see repeated hospitalizations, vigorous medical evaluations, right? The mom wants a lot of medical testing. She's getting emotionally fed by this whole medical attention that the child's getting. So that would be Munchausen by proxy. So there is a case study. His name is Jerry, the little boy with spina bifida. That's on Canvas. You guys are to read that. And then there is a discussion activity based on that. Thank you. Let's see. I will stop sharing. And do realize that child abuse and neglect is one of the forms of adverse childhood experiences, and we'll be talking about trauma-informed care next.